Thanks so much, Alyssa. And as she mentioned, my name is Ted Henson. I'm the Director of Health Center Growth and Development here at NAC. I have had the honor to work on outreach and enrollment issues at NAC since 2014. And so on behalf of everyone here at NAC, our full team, we want to welcome you to today's webinar on the PHE Unwinding Readiness webinar for health centers on preparing Medicaid beneficiaries for eligibility determinations. That was a mouthful. We're here today to talk about how to get prepared for the unwinding of the PHE. I do want to pause briefly to say thank you to everyone for all you do day in and day out to keep your communities connected to coverage and to care. Also, please continue to introduce yourself in the chat. It's great to see so many familiar names. I think we had 1,200 people registered for today's webinar. So we do recognize a lot of you, but a lot of new faces. So let us know where you're from, your organization, city, state, your title too. See a lot of navigators, enrollment assisters, community health workers. That's awesome. Thanks for being here today. So just quickly on NAC, if you don't know who we were founded over 50 years ago. We proudly represent all community health centers and work to promote efficient, high quality, comprehensive healthcare that's accessible, culturally and linguistically competent, community directed, and patient centered for all. So again, we want to thank you. You're the real heroes for all the work you do every day. Next slide. So we assume most of you are from community health centers, but even if you're not, or even if you are, we want to provide a couple quick facts about the health center program. As I mentioned, there are over 1,400 330 funded federally qualified health centers. We know there's over 100 FQHC lookalikes as well. And together you serve over 29 million patients at 13,500 service delivery sites. That data is from 2020, so we know it's actually increased likely since then. You provide patient-centered, comprehensive, culturally competent primary care and enabling services. And I just want to take a second to pause and mention enabling services because they are actually defined in the 330 Public Health Statute, Section 330 of the Public Health Statute. And that includes transportation, case management, referral services, transportation interpretation, health education, environmental health risk education, outreach, and eligibility assistance. According to 2020 UDS data, there are over 4,000 enrollment sisters at community health centers, and together you provided over 4 million assists. So please give yourself a pat on the back. You do amazing work. And that also just includes Medicare enrollment, Medicaid CHIP, and marketplace coverage. So really the goal of today's webinar is twofold. We want to give you a policy update on really what's happening. What does this all mean? And we want to provide a timeline for the end of the public health emergency and really the policy implications for Medicaid and marketplace coverage, really what's at stake. Then we are going to really dive in deep by hearing from people doing actual work at health centers to highlight strategies and tools being deployed by health center outreach and enrollment staff to educate Medicaid beneficiaries and really your communities in order to ensure access to care. So to accomplish this, today I want to talk about our agenda. We're going to start, as I mentioned, with a policy overview. And that's going to be provided by my NAC colleague, Jeremy Crandall, who is the Director of Federal and State Policy. Jeremy will catch us up to speed on what's at stake and what the potential impact is for the ending of the PHE. After he speaks, as I mentioned, we'll have an interactive panel featuring 3 health center outreach and enrollment staff leaders. Our panelists will provide insight on how their health center is preparing for the end of the PHE, which key staff are involved, what tools and strategies they are utilizing, and key messaging. Time will be reserved for Q&A, and just to answer the first question right now, yes, as Alyssa mentioned, the slides will be available along with the recording after today's webinar. You will receive an email. Follow up with us if you do not receive that email within 2 weeks. It's my honor to turn things over to Jeremy Crandall. Jeremy, take it away.
Great, thanks, Ted, and good afternoon or good morning to everyone that is joining us today. So in the next 7 or 8 minutes, what I really want to do is level set where this issue began and where we are at now. And really set the context of the current dynamics. So the best place to start is with the Families First Coronavirus Relief Act that passed early in the pandemic in early 2020 that was specifically designed to make sure that there was greater certainty for the funding for the Medicaid program at the state level at what was obviously a time of considerable uncertainty. And so what that congressional action did is that essentially in return for states receiving a 6.2% bump in their Medicaid assistance percentage from the federal government, in return for that, any state that accepted that FMAP bump would then be prohibited from disenrolling any other Medicaid enrollees for the duration of the public health emergency. And really, I cannot overstate the extent to which we have been closely tracking this issue throughout the pandemic up until now. And one of the ways that we did that was NAC conducted a survey late last year that really looked at what is commonly understood as the continuous coverage requirement that you will hear about. What this and other flexibilities, what did those measures do in terms of enabling health centers to protect access to care? And there was a wide-ranging survey that NAC did that I can put in the chat, but one of the stats that we found is that 90% of health centers reported that this measure and a number of others enabled the health centers to provide more access to services. And so when the PHE, the public health emergency, ultimately does expire, states will start to undertake their redetermination processes. And so if you're on this call, you likely have some understanding of the inherent challenges of protecting access to care for people on Medicaid. And then considering how much more difficult that will soon be when all the dynamics related to the PHE and Medicaid enrollment really ramp back up. And that impact will especially be felt by people in communities of color. There was a recent Kaiser Family Foundation study that found that somewhere between 5 and 14 million Medicaid enrollees will ultimately be disenrolled in the months following the end of this continuous enrollment requirement. And when almost half of all of our patients are on Medicaid, we really can't overstate how much of an impact this will have on our patients. Next slide, please. So much of this entire issue is centered around timelines, and these next few slides very much paint that picture. I do want to give a massive shout out to the Georgetown Center for Children and Families. The next few slides, I very much borrowed from them, and so very much want to give them a shout out for the content that you're about to see. But really, so much of this issue is, of course, directly tied to the public health emergency declaration. The next point in time where it will ultimately come up for expiration or renewal is in approximately 2 weeks in mid-July, based on everything that the federal government, that the Health and Human Services Department has said. We fully expect that there will be a renewal. They have said that they would provide 60 days notice 60 days notice that there would be an ultimate expiration, that it would not be renewed. We are within that 60-day period, so we fully expect that it will get renewed again. The next expiration or renewal date would be mid-October. Full disclosure, that is a couple of weeks before an election. And so, there is potential for it to be extended at least one more time into January. There's one other key element here that you see in these question mark bubbles here. And that is what happens in Congress with whether it's the Build Back Better plan or a number of other, there's a lot of conversations about extending the ACA, Affordable Care Act subsidies and otherwise. There were significant provisions in Build Back Better that would have provided a bridge to coverage and protecting access to coverage as it relates to this issue. And so until and unless Build Back Better passes or is completely and officially, dead, so to speak, there's a lot of important elements in that to keep in mind as well. So next slide, please. This next chart really lays out what was ultimately put into place by CMS in March of 2022. And really the main takeaway that I want to share with this chart, and all of this is publicly available, but states will ultimately have 12 months to catch up on delayed renewals and changes in their circumstances. And states may initiate renewals starting 2 months before the end of the public health emergency, but may not terminate coverage until the last day of the month in which the PHE ends. And then specifically, the last batch of renewals that states undertake must be initiated no later than the 12th month after the first batch of renewals, but states will be given an additional 2 months, to complete that last batch. So essentially, we're talking about a 14-month window here. Next slide, please. I am trying to get through all these slides as quickly as I can without talking very, very quickly, because I only have a couple more minutes. But this next slide, really what this paints, and again, credit to Georgetown Center for Children and Families for creating this, really paints the picture of the maddening, complicated web that Medicaid enrollees are going to be facing. whether they remain eligible for coverage, whether they are no longer eligible, and the various pathways that exist for them, and the potential lack of affordability with some of those measures that we're going to talk about, or if they are ultimately disenrolled for procedural reasons. Next slide, please. So I previously touched on what CMS said about timelines related to this issue. In March of 2022, CMS issued a state health official letter. It was approximately 50 pages that included a number of other elements related to this issue, specifically about how states have to develop their own unwinding operational plans. Every state is required to create one. Every state is required to share those with CMS. There are a lot of details related to it. And really one of the key pieces there is that there's a strong recommendation that state Medicaid departments communicate with external stakeholders, including providers, on those unwinding operational plans. Next slide, please. And so that brings us to, I only have 2 slides left here. What next? What are the next steps? And so if you were on this call, I'm sure many of you have already heard of the critical importance of Medicaid enrollees updating their contact information, updating addresses, so that the state and that other outreach and enrollment specialists can keep in touch with them. So I'm sure folks are familiar with that, and the other speakers are going to touch on it. But number 2, another one, is engaging on these unwinding operational plans. State Medicaid departments have a lot of work to do in this space. And so the more that folks that are aligned with the health center movement or working in health centers can be tapped into those efforts, the better. I'm going to touch on number 3 a little later in our Q&A, but we really want to foster a recurring a feedback loop on recurring problems that you all are seeing on the ground once this really kicks into high gear. And then finally, we take very seriously our role here at NAC as a national stakeholder. And I have to emphasize, there are so many players in the national Medicaid and national ACA space that are paying very close attention to this issue. We are working very closely with many of them. And so the more we can all be communicating with each other from the ground, to national organizations and in the other direction as well, the better. Next slide, please. This is the last one, and I'm going to rush through this as well. But there are a couple of elements that are not specific to Medicaid that are absolutely going to have implications on this conversation as well. The first one is whether the ACA subsidies that made the advanced premium tax credits more generous, reduced cost sharing, expanded eligibility. There were a number of elements in the American Rescue Plan that very much made ACA coverage more affordable. Those protections are ultimately going to go away absent action from Congress by the end of the year. And so this is absolutely something that we need to pay close attention to. And then finally, anybody that is aware of the Affordable Care Act family glitch, there was a proposed rule. I believe it is in final rulemaking at this stage that was put out by the Biden administration. This is also another element that is really important to be paying attention to as well. I'm going to pause now because I'm over time. We can go back to that if anybody has questions.
Jeremy, thank you so much. That was very efficient. Well done. I just really want to flag for folks those slides that Jeremy showed with the timelines, both the potential ones and then the longer one over 14 months. Those are great reference slides. Thanks for the shout out to Georgetown as well. And want to remind folks you'll have access to those slides. Thank you also for the key actions to take now, which is really going to be sort of how we're going to dive deeper over the panel. But before we do that, I thank you for also going more in depth on the APTCs and the family glitch, because those are very critical issues that are happening around the same time. So now that we have a sense of what's at stake, let's turn our attention to what health centers can and are doing to get ready for this potentially historically significant moment in healthcare. I do want us to actually get into the weeds today of how health centers and their O&E staff in particular can serve as the linchpin in the public response and effort to keeping individuals enrolled into coverage. So to do this, we're going to transition into an engaging, hopefully interactive panel discussion with 3 excellent, experienced health center leaders in the outreach and enrollment space from 3 very different parts of the country. The first will be Abby Sanchez, who's the Outreach and Enrollment Program Coordinator at North Country Healthcare in Flagstaff, Arizona. Thank you, Abby. Next was Becky McMullen, who's Director of Outreach Success and Enrollment at HealthSource of Ohio in Loveland, Ohio. And last but not least is Julia Garvey, who's a policy advisor and navigator at Partnership Community Health Center in Appleton, Wisconsin. So let's start with Julia. Next slide, please. You serve in a unique role as an employee of a federally qualified health center partnership in Wisconsin, but you also work for your state primary care association. So, how is your health center and how are you preparing for the end of the public health emergency?
Thanks, Ted. Yeah, we all wear a lot of hats in our work, don't we? So here in Wisconsin, our Medicaid program has grown by almost 400,000 members. So we currently have 1.57 million people enrolled in Medicaid right now. When it comes down to the time that we get the green light to start the redetermination process, that means 50 to 60,000 people a month are going to go through this process. That means our staff, outreach and enrollment, and all levels of health center staff at our 17 community health centers with over 100 locations have a big role to play in this lift. Next slide, please. So Wisconsin's convened a public health emergency unwinding task force, and information flows from the Department of Health Services through monthly meetings to provide policy updates on our programs impacted by the public health emergency, like food share and Medicaid. They share preparations for completing these redeterminations and projected timelines for notifications when we get the green light. The stakeholders who join provide feedback on communications, which data will be helpful to drive outreach, and ask a lot of questions. Next slide, please. The Wisconsin Primary Healthcare Association has joined in this task force and as an advisory role in the data subgroup. This is a strategic placement to help drive organizational strategy to maximize patient engagement and financial stability for health centers. Our Primary Care Association has also invested my position to lead a peer learning network for outreach and enrollment assisters. My discussion today is based on Partnership Community Health Center, but through our peer learning network discussions, I can assure you that each of our community health centers in the state are leaders of grassroots outreach and enrollment activities that fit the unique needs of their communities. Their boots on the ground work with Medicaid members provides valuable feedback to the state task force. Another collaboration I want to highlight is with our federal navigator entity covering Wisconsin. You will see examples of their excellent health insurance literacy materials, and they also support enrollment assisters with marketplace policy and enrollment best practices, education and training, and our annual enrollment conference where many receive our continuing education credits. Covering Wisconsin has subcontracted with health centers in the state for enrollment assisters. They recognize that health centers are well situated in their communities to have discussions about coverage on healthcare.gov, and this has helped build capacity and funding support for enrollment assisters. So you'll find both certified application counselors and navigators in health centers. Next slide.
All right, here in North Country Healthcare in Flagstaff, Arizona, we have about 17 access points across 12 communities in Northern Arizona. So we consider ourselves well positioned for the PHE unwinding efforts. Here we are in collaboration with local, state, and federal collaborations to ensure that correct and consistent messaging in this beginning phase of the PHE unwinding. We are also working with our state Medicaid plans, but they have directed us to work more closely with our plans directly. The InReach efforts, we are currently reaching our patients who have or had Medicaid insurance in the last 32 months. And we all are also putting a lot of efforts into outreach with our community partners, community events, and providing a lot of education. Next slide, please. During the PHE unwinding process, we have been working closely, as I mentioned, with our Medicaid health insurance plans. They have provided us with mutual patient rosters, and this includes our patients and patients also assigned to us, so we have that those rosters available to us. We also are working with the health plans with assistance with education and, of course, the renewal process once the PHE does end. We're very fortunate to be able to have available access to sponsorships for funding for events, giveaways, flyers, standing posters, and also the possibility of stipend interns depending on the demand for when that PHE does end. Next slide, please.
Ohio is the largest federally qualified health center in Ohio. We provide primary care, dental, vision, women's health, pharmacy, and outreach services to over 60,000 patients in our 8-county service area. From east of Cincinnati, where everybody rides Metro, to our furthest eastern Appalachia County, where we have a hitching post outside our health center. Our outreach and enrollment team can assist any Ohio resident with presumptive eligibility, Medicaid, SNAP, Marketplace applications, and consistently assist referred consumers from over 16 counties. While we wait on Ohio to release its unwinding plan, HealthSource is preparing for the unwinding by working with local, state, and federal agencies such as the Center of Budget Policy and Priorities, CMS, the Ohio Association of Community Health Centers, Young Invincibles, and our local county departments of Jobs and Family Services to ensure correct and consistent messaging to educate our consumers on the ending of the public health emergency, the Medicaid unwinding, and the application renewal process. HealthSource is working with Medicaid managed care plans and conducting in-reach to current Medicaid patients to ensure consumers are updating their current contact information with their local Department of Jobs and Family Services. We are outreaching to beneficiaries with the help of our community connection agencies and partners who refer consumers to us for application assistance and asking them to post our flyers and have our contact information cards available for their Medicaid customers who need assistance with the renewal or application process. We continue to expand our reach to consumers by making new community connections, growing our referral base, and by participating in community events at local agencies, schools, library systems, and providing information for beneficiaries on how, when, and where to get renewal assistance.
Thank you, Becky. And as I've mentioned to Becky before, I believe HealthSource is the only health center I've heard of that has a hitching post at one of their sites. So if anyone else listening has a hitching post, please let us know in the chat. I would be very interested to know. So you all, was that none of you are really acting alone? Julia mentioned her work and involvement with the State Public Health Task Force. We heard from Abby the work that you're doing with the Medicaid health plans. Becky, you listed a long list of national and local partners from the Center Budget Policy Priorities, CMS, to Young Invincibles. And I do want to give a shout out to YI and their Get Covered Coalition for their amazing work. So now I'd like to turn our attention to the question of who's involved at your health center with your response. How are your staff engaged and made aware of this issue, and who's doing the outreach to the patients? Becky, I know HealthSource has a strong outreach and enrollment department, and you've been strategically engaged other staff in the response. So can you tell us more?
Thank you, Ted. All departments of HealthSource of Ohio are involved in outreach in their own way. Insurance coverage is a part of all patient and consumer interactions. Checking for coverage and referring to outreach if someone is uninsured or underinsured allows us all to assist in bettering the health and well-being of our patients and communities we serve. Our current 3-person outreach and enrollment team consists of 1 certified application counselor and 2 outreach success coordinators. We create partnerships with local agencies, participate in community events, process presumptive eligibility, Medicaid, SNAP, and Marketplace applications, and address consumer questions that help them better understand their coverage and benefits. Our outreach and enrollment conducts a phone screening for each individual that contacts us or is referred to us for assistance to determine what benefits they may qualify for and how best to assist them. We provide in-reach with the assistance of our health centers, front office staff, and care coordinators who have identified patients needing Medicaid assistance and application assistance through an established referral system. Our finance department works with the Medicaid managed care plans and provides lists of uninsured, underinsured, and sliding fee patients needing application assistance. Our marketing and development team assists in creating our printed materials and runs our social media messaging, as well as provide shelf-stable food kits to patients who report the need for food assistance during health center appointments. We have our contact cards inside each bag for patients to contact us for SNAP, Medicaid, and PE application assistance. Our operations team assists with outreach and enrollment efforts with referrals received directly from our providers for patients needing coverage and assistance. We rely upon our IT team for technical support, and our HR department allows us to present outreach and enrollment services, materials, and instruction to new HealthSource staff members during the orientation process on how to refer patients to outreach for assistance with applications. Next slide, please.
Here at North Country, we have a Medicaid unwinding committee that we formed, and this is to help us come up with strategies and talk about different tactics for the PHE unwinding. So some of the people that are key players in our committee is going to be our Director of Outreach. She oversees our strategy and efforts. We have a Director of Marketing who oversees marketing strategies and also helping us come up with long-term solutions. We have a patient retention specialist who is helping us with our overarching strategy, which is our text messaging system, and also helping us get organized with the workflow. Our data specialist is helping us pull patient rosters from our EHR that have Medicaid or had Medicaid from the last 3 years and helping us analyze that data for our text messaging system. We have a senior operations manager who helps provide support and suggestions from the operation side of things from our clinics, and also working with providers. And then there's also myself, which is the outreach and enrollment coordinator, and I will be implementing the strategy. Next slide, please. So there are several staff that are involved in our strategy, and like I said, our overarching strategy is our text messaging system in this first phase of the PHE unwinding as we prepare. The preparation of our strategy, like I said, is going to be with our Medicaid unwinding committee. So they're going to be preparing, problem solving, making sure that everything is laid out for the execution. For the execution, we are going to be using enrollment staff, front desk staff, and providers. Once that text message does go out to our patients, that they will be the one executing information. Now we'll go more in depth as to our strategy later. The maintenance of our plan is going to be myself and then also enrollment staff. A training has been held to help outline the strategy, also to explain the roles of everyone involved in our plan, and also provide that education because some members of our organization might not know what the PHE is and unwinding, how it could impact our health centers and also our communities. And we hope to provide a lot more trainings as this transition continues on. Next slide, please. We have several enrollment staff. One primary enrollment staff is our InReach. So they assist with sliding fee scale, marketplace, Medicaid, and SNAP. There are several types of appointments that they do, and that would be scheduled appointments, walk-in, and then the InReach portion of their work is going to be addressing those social determinants of health and also helping onboard new patients and making sure that they understand kind of a little bit about health center work and what we do. The outreach and enrollment staff are primarily grant funded. So we have the CMS Navigator grant, we have Connecting Kids to Coverage, and we also have the SNAP-O grant. So the outreach enrollment staff will do Medicaid enrollments, Marketplace, and also SNAP. Their primary focus is, and their appointment type is going to be referrals and then also by request. So this can be the patient reaching out to them from information from a flyer, or maybe a community partner reaching out and saying, can you help this member? They do a lot of community outreach and events, so that's that portion of our staff. I think one thing to mention is that a positive outcome of the PHE has been the implementation of virtual and over-the-phone enrollments. I think that has been so valuable during this kind of period, is that we were been able to help a lot of patients over the phone so that they wouldn't be able to, if they're not able to come in person, maybe they have transportation issues, location, or even maybe funding, that we're able to help them over the phone. So that has been a huge part of what we do.
Thank you. And, I want to piggyback on what you just said about telehealth, because we've really transitioned to that as well. We're able to serve so many more people who don't have to worry about transportation as a barrier. And although we don't have a hitching post, this means that people can come from our farthest rural counties via phone and Zoom and get excellent assistance. So Partnerships Outreach and Enrollment Department began in 2013 with the rollout of the Affordable Care Act. We partnered with the United Way to educate and prepare our community to get enrolled in the marketplace. We licensed the first certified application counselors in the state, and through our community conversations, we coined the term coverage to care, although we didn't patent that, and CMS quickly took over that phrase. Our enrollment team works year-round in our community to ensure that Everybody has access to free local help to get enrolled, understand health insurance, and access care. Partnership embeds outreach and enrollment staff in our dental and medical departments to meet with uninsured patients, provide resources, and reduce barriers to care like transportation. Lisa met with a gentleman recently who had been released from incarceration of 24 years, and by supplying him hygiene products and community resources, helped to welcome him back into the community. Amber works with people directly who are experiencing homelessness at transitional living facilities, emergency shelters, and food pantries to reach people who may not receive mail at a permanent location. Cassandra works within our school district to assist low-income and high-risk students and families to access medical, dental, and behavioral health care. And Lydia's connected our services to the LGBTQ plus community and families with special health care needs. Next slide. So we introduce our outreach and enrollment work to all new staff during orientation. And one new dentist made this connection. This is exactly what everyone else is missing. An example of our collaboration within our health centers early in the pandemic, dental assistants were scheduling future treatment plans and finding end dates in the computer system that showed coverage. And we, as policy experts in outreach and enrollment, had to work very hard to then share messaging throughout our whole health center about what continuous eligibility would mean for our patients, and so they could feel confident scheduling future appointments when they saw conflicting information in the systems that they look at to check coverage. We provide updates to all department leads at weekly meetings, and when we get notification that it's time to take action, we will provide an all staff update. So all staff across the board, front desk, billing, anybody who's helping people get prescriptions, anybody who needs to know that people still have Medicaid and that it's important to renew their coverage is aware of the impact and importance. In terms of messaging to patients, we also use care messaging. It's a very effective way to text our patients. A lot of times when people get mail, especially with a partnership logo, they might confuse it with a bill and not want to open it, but we found a lot of success with texting. Everybody looks at their texts. We use social media and web-based. We're adding messaging to the bottom of billing statements if they open them. And our summer strategy has been to go back through our electronic health records and reach out to patients, many of whom we haven't talked to since the very early days of the public health emergency. A lot of those people were new to Medicaid. So our conversations are around, do you know you still have coverage? And are you using your health care that you have access to? And just general conversations of how are things going. Bridget reports that some of these people are really using their health care. One man pointed to the increase of stress that he's experienced, and he's very grateful to have access to care. Some people have gone back to work and have had questions about transitioning to employer coverage when the PHE ends. And then we're also taking this time to check in with our community partners, again, many of them that we haven't seen for a long time. We're using outreach cards and we're having conversations about what it looks like to keep your information updated. And then we're going to continue our relationships in the community around messaging with radio ads and any earned media. Next slide.
Thank you all. That was excellent. And just on a light note, I want to highlight that in the chat, there was a question about what is a hitching post, Becky? There was a definition. And shout out to Scenic Bluffs Community Health Center in Cashin, Wisconsin, Community Health Centers in the North Country in New York State, and Marshfield Clinic in Marshfield, Wisconsin for also having hitching posts. So I can add to that list now. So just to kind of recap what we heard, because I think it's really important, health center outreach and enrollment staff are on the front lines of this. Abby mentioned the outreach and in-reach staff. All of you all mentioned certified application counselors and I think navigators as well. But we also heard about front desk staff, care coordinators, marketing staff, development staff, finance staff such as sliding fee counselors, data and IT staff, operations, clinical providers, and even board level support. So I think to me that really underscores that this is sort of a whole health center issue and everyone is involved at some level. Now we started to touch briefly on some of the tools you were deploying. Julie mentioned briefly care messaging. Care Message is the text message company. But let's dive a little bit deeper and let's start with Abby. What tools and strategies are you implementing to really reach out and educate beneficiaries?
Absolutely. So we have various tools and strategies that we believe will have a huge impact during this transition. Like I mentioned, our primary strategy is our text messaging system with Care Messaging, which I will go more in depth in a few slides. We believe that educating the community is going to be valuable and really impact making sure everyone is aware. We want to attend a lot of events in the community and also have a lot of conversations with community partners. We believe that social media is going to have a huge impact as to our tools and strategies. Also, patient interactions, making sure that every patient that we connect with, we're educating about the PHE unwinding. And also other agencies in the community that might also be impacted by this, but may not be in the same circles, and I'll go into that a little later. I think training our front desk staff is also going to be a valuable point, because if someone's coming in for an appointment that is a Medicaid patient, we want to make sure the front desk staff are asking, have you updated your information with Medicaid? Or after the PHE ends, have you renewed your Medicaid insurance? On the left are some events that we have attended throughout the year, and just kind of a little glimpse, hoping that we're going to be attending a lot more events for the few months or the rest of the year to come, and we'll be using those moments to educate the community. Next slide, please. The text messaging strategy, like I said, is going to be through Care Messaging. We're planning to send out a mass text message to all Medicaid patients within our EHR, our electronic health records, to ask them to update their information before the PHE ends. So we want to stay proactive, making sure that we get everything ready for when the PHE does end. And then also renewals for when that PHE does end. Currently, we have about 33,000 patients within our electronic health records, about a 32-month look back of people that have or had Medicaid. And we want to make sure that we're using that information and updating the Medicaid system. We're making sure that the patients understand that this is a HIPAA secure form. So with fields for updating the information, so we're asking them to update their phone numbers, their emails, their home addresses, their mailing addresses, so that when Medicaid state plans do end that PHE, that they're getting the correct letters and information. We also are wanting to work with the enrollment staff and the front desk staff who will be helping us with taking those same forms and also updating our EHR system. So kind of a little 2-in-1 there. And I do want to share what our text message is going to look like in case it's helpful for anyone else. So we're going to say North Country Healthcare. Our records show that your contact information needs to be updated. If you do not take action now, you may be at risk of losing healthcare coverage. Updating your information is fast, easy, and secure. Visit link to complete the process. So once they do click that link, it will be going to our web form and on our website, which is very HIPAA secure. Our IT department has locked it down very tightly. So just making sure that people understand that as well. And we want to make sure that we're repeating the same communication, and we're also using risk communication. We're not causing panic in any way, but we're making sure that they understand that they could lose coverage. And also that repeated communication. We're using the same language that our health plans are, that just the whole state is using. Next slide, please. Like I said before, our community education is very important to what we're going to be doing. So we're going to be having a lot of conversations with our community partners, people that we have built relationships with over the years, and just making sure that they understand what's to come, how it could potentially affect them, especially those who serve Medicaid populations. We also want to attend a lot of events, like I said. The summer's coming up, so a lot of events are opening, and a lot of family events. So we're going to be attending those and touching every patient or person that we're talking to. We also want to use social media, Facebook, Instagram. We also want to do a huge marketing campaign. We know that each area is very different from each other, so using whatever way the population receives their information there. Also, other agencies impacted, I mentioned this a little bit earlier, but just really working with those agencies who are serving Medicaid populations but might not know much about the PHE unwinding. Maybe they're not in these kinds of webinars. They don't visit the same circles we do. And kind of an example of this is we were working with a clinic system here in Northern Arizona, and we had mentioned the PHE unwinding to them, and they had no idea what it was. They hadn't heard anything about it, and a large population they serve is Medicaid patients. So we were able to educate them, make sure they understood what the PHE unwinding means, and they were very surprised, and we're starting to plan more ahead. So working with those agencies is going to be very impactful. Next slide, please.
So we're also spreading consistent messaging in our health centers by using the Department of Health Services Task Force Toolkit. The Unwinding Toolkit has postcards, flyers, and they all have consistent messaging, and we're able to personalize them with our health center information and contact information. Our messaging right now is that the public health emergency is not over, asking people to keep their addresses and contact information updated, and these are available in Spanish, Hmong, and English. Our state's also really reinvigorating regional enrollment networks. In our area, I lead a group of about 12 counties, and we're using some funds from this revitalization to help print tens of thousands of outreach cards that we're going to use with our community partners and our surrounding counties and their agencies and partners to personalize so that everybody has the opportunity to share this information. Because like Abby, there are many, many community partners who have patients who are enrolled in Medicaid who don't have any idea that they've remained continuously eligible and that at some point these policies are going to change and that people who want to retain their benefits will need to do this redetermination. Next slide, please. And I should have titled this slide, "We Can Help You Understand," because I think the best value that outreach and enrollment departments bring to health centers, patients, in the community is in the field of health insurance literacy. We help interpret the complex language used to determine eligibility for programs by using language that people understand, using examples based on what we've learned from them in our discussions of their needs, and we utilize Teachback to check for comprehension. The best part of my job is when a young adult tells me, "I wasn't taught this in the school, my parents never talked to me about health insurance, and you've made this understandable. I understand the insurance we enrolled in today, but I also understand the importance of staying insured for life." These health insurance literacy skills that we develop as part of our patient-centered care will be even more valuable as we help people who need to transition to either employer coverage or to the marketplace. The young adult that I helped to enroll in Medicaid established primary care in our health center and will have a trusted partner in her health. She knows to reach out to me if her job changes or if she moves. And she started this relationship with our health center through the door of enrollment. For most of our outreach, we use personalized materials by Covering Wisconsin with images that relate to people that live in our communities, messaging that's unbiased, and that gives people a choice to reach out to a free local assister. Next slide. We're also using COVID vaccine events in our area to increase health equity by expanding our collaboration with a multicultural community, a group of diverse leaders who formed in the beginning of the pandemic to address COVID-related disparities in racial and ethnic communities. This group includes leaders from the Hmong, African American, and Latinx communities to provide trusted voices with trusted messaging in the locations familiar to the community. Our outreach and enrollment staff participates in these COVID events, and we look at this work as essential to our health center mission. It's great to hear from new neighbors, and it increases awareness of Partnership Community Health Center. And in this slide, a picture sends 1,000 words. In the middle here, you'll see Kay, who is a Black barbershop owner. He's surrounded by members of the multicultural community committee, and then our Governor Tony Evers, who came up to our Fox Valley region here to participate and see how we're doing outreach in the community. Next slide.
For consumers who were newly enrolled onto Medicaid coverage during the public health emergency, the unwinding will be the first time they will experience the annual renewal process for retaining coverage. HealthSource of Ohio is using a combination of direct messaging, staff education, and community-assisted education to ensure beneficiaries receive important, correct, and consistent unwinding information, and to ensure they understand the instructions and complete the process renewal. We will use a multi-layered approach involving community flyers and postcards created with guidance from the CMS Unwinding Toolkit for correct and consistent messaging and instruction for consumers. Next slide, please. We will publish unwinding updates for HealthSource of Ohio staff members through our weekly employee newsletter article, including how to answer patient inquiries at the health centers for our front office staff, care coordinators, and providers, and a reminder of how to refer to O&E for renewal and application assistance. HealthSource is creating a frequently asked questions sheet to share with our health center offices, local libraries, and community partner agencies that advise beneficiaries on the unwinding, what to expect in terms of the process of renewing information for redetermination, and who to contact for assistance. HealthSource has created a two-step reminder system for contacting the 3,000 plus consumers we have assisted since the beginning of the public health emergency. We will send letters and make phone calls to all consumers, educating them on the process of the renewal and redetermination, and we will promote education and assistance with social media messaging. Our outreach and enrollment team will also communicate redetermination information with consumers by sharing flyers, postcards, and HealthSource contact cards with community partner agencies to display and share with their customers for renewal instructions and application assistance. We will continue to participate in community events and activities with partner agencies, local schools, and library systems, educating the public on the ending of the public health emergency, the unwinding of Medicaid, and the process of renewal and redetermination to continue receiving benefits. Next slide, please.
Great, thank you all. There were just so many helpful tools and strategies listed there that it's hard to recap that. But I would want to thank also everyone in chat. There's a lively chat going on right now, sharing resources and strategies. Thank you to whoever shared the link to the CMS toolkit that we referenced. And as we sort of go into the next question that I'd love to engage our panel on, it's really around, we talked about this, but what are the most effective and key messages that you've been using? I'd like to actually start by turning things back to my colleague, Jeremy, to get his perspective from the national level. Jeremy, what do you advise for everyone listening on how to effectively collaborate on national messaging and engagement during the unwinding?
Yeah, thanks, Ted. I'm going to add more than just one sentence, but I can say it in one sentence. Talk to us and let us know what you're doing at the NAC level. We're still sort of formulating a little bit based on some partnerships that we already have with some other organizations, but we are very much standing up in various ways our information sharing at NAC. Many of you are probably from anybody in this space that works on 340B. No, I'm not about to go down a 340B rabbit hole, but anybody that works in that space knows that NAC runs a site called NoddlePod that is a really good information sharing and tool. And we are very much planning on launching something similar as it relates to this issue so that you all can share information with each other and then we can share it out via our various channels as well. So that's not directly about educating consumers, but I really can't emphasize enough. There are so many partners at the national level that are paying close attention to this. And we really, really take seriously our role at NAC as a traffic cop, if you will, to make sure that information we're getting is going out to you, and then we're able to facilitate sharing it all facilitate you all sharing it with each other as well. So I'll stop there, Ted.
Thanks. And actually, before we turn it over to Julie, I just want to give a shout out to all the members of NAC's Outreach and Enrollment Learning Collaborative that ended last week. We had about, I think, 50 organizations that were signed up for that, and we were able to engage with CMS, with CSIO on that learning collaborative. We also had Young Invincibles, as I mentioned before, come and provide some policy updates. So it's real, as Jeremy mentioned, it's really important for NAC to be able to have those conversations with folks like you on the ground doing the actual work, so we can hear what's working, get materials out to you, and then relay any concerns you have onto federal partners or other national partners. And with that, I'll turn things over to Julia.
Thanks. So we're staying consistent with the state messaging, using those outreach cards to keep your addresses and phone and email information updated, to watch for letters that will prompt you to take action. And we're really assisting our members to download a MyAccess app or to create the online access account. Not only do we have those materials, but we're ready to use them wherever we are. We all have outreach bags in our cars full of materials, because you never know when you're going to have the opportunity to discuss coverage and care when you're out and about. Martha, our bilingual administrative assistant here in the office, overheard a conversation while enjoying an adult beverage and was able to share information with people that were around her about our prescription assistance program and connect them to care at Partnership. And many of the people enrolled in Medicaid right now are not that aware of what we are all talking about in terms of the public health emergency eventually ending. So what we're hearing mostly are questions about coverage. And I think this is a huge role that community health centers can fill, is filling the gaps in communication. So we weekly get calls from patients who have questions about whether they still have Medicaid, or if they've received a system-generated letter that's incorrect, that we can help clarify and ensure people still do have coverage. And we're also using this time to have conversations to remind people to access care that's meant for them to use. We're planting seeds for the future of when you're asked to complete your renewal, we can help. And if you're no longer eligible for Medicaid, we can help. Next slide, please. We're also using this unwinding and this extra time this summer as an engagement strategy. Community health centers play a unique role in helping our community and community members to get enrolled and stay enrolled in Medicaid. Also, by using our health insurance literacy skills to help them understand how to use their benefits and access care. We'll help them through the renewal process, empower them to report changes and take action when needed, and essentially ensure that people don't fall between the cracks of these complex systems. This is the role of health center work and outreach and enrollment. And Partnership has always viewed our outreach and enrollment work as mission-driven and an opportunity to grow and retain patients. We can help them maintain continuity of care by keeping them insured and reducing the barriers to care. And in our discussions of health insurance and wellness, our summer check-ins of how you're doing and are you using your care? Do you have any questions for us? Let's stay connected. We're also making for sure we're meeting new people throughout the summer at our community events and bringing them awareness of our community health center. We connected with over 200 people yesterday at a COVID event staged in a library, where we just had so many people coming through, and it gave us that opportunity to have this coverage and care as families were getting information and vaccinated. So for Partnership, outreach and enrollment work is embedded in our health center mission and built into all community conversations to maximize impact. Next.
HealthSource of Ohio's outreach and enrollment team is focusing on consumer education and key messaging, encouraging consumers to update their contact information with local, county, Department of Jobs and Family Services by logging into the portal at benefits.ohio.gov or by contacting the Ohio Department of Medicaid. We are reminding consumers to check their mail for notifications from their county Department of Jobs and Family Services on when and how to complete the renewal process to retain coverage. We will encourage consumers to complete and return forms by the deadline stated on their notifications of renewal. HealthSource will educate consumers and beneficiaries that we are here to assist with Medicaid to marketplace transition assistance for those who no longer qualify for Medicaid coverage. HealthSource of Ohio is a trusted resource for free application assistance for all Ohio residents. And for those who wish to complete the Marketplace application on their own, we will advertise and promote using healthcare.gov as the trusted site for obtaining healthcare. In the past, we had a consumer not use healthcare.gov and purchased a too good to be true plan that was only valid in the state of Utah, rendering it useless here in Ohio. We want consumers and beneficiaries to know that now is the time to use coverage while it is still active, the time to update contact information with their county departments of jobs and family services, and the time to ask questions. Next slide, please. To accomplish this best, we are working with our community partner agencies, local schools, and library systems to post our informational flyers about the unwinding and have our contact cards available for their consumers needing assistance with the renewal process. Our outreach and enrollment team is honored to work with many local organizations as a two-way referral system for services needed and shared by community members. We have created relationships with a wealth of community partners, including recovery centers, pregnancy centers, LGBTQ+ agencies, homeless shelters, faith-based organizations, food banks, re-entry organizations, and many more resources that share our information with their customers and refer them to us for application assistance, and we refer to these same agencies for resources needed by the consumer. In 2021, we assisted 291 people with substance use disorder by processing presumptive eligibility applications, completing their full Medicaid application, and getting them into recovery services because of the relationships we have made with our community connections. We will continue to work with our community partners to promote consumer and beneficiary education about the ending of the public health emergency, the Medicaid unwinding, and answering questions of how, when, and where to get renewal assistance. Next slide.
So before the PHE ends, our key messaging is going to be updating information so that when the PHE does end, they're getting the correct letters, contact information, and all of that. We want to make sure that patients and community members are aware that their information is HIPAA protected, everything is secure, and that they're also working with qualified enrollment staff who can help them through that process. After the PHE ends, we want to focus on renewals of applications. We also want to make sure that we're putting a lot of effort into scheduling medical appointments. We want to make sure they're up to date on their medical services, and if they do lose coverage, that they're getting their preventative visits and also those visits with a primary care provider. And lastly is also just to make sure that the people that may lose coverage for Medicaid do get transitioned to Marketplace. And with that, also just making sure they understand that people who are helping them are qualified and they can help them understand the various terminologies, tools, subsidies, and they understand all of that. I think one thing to note here is that we're using terminology that is known to people who may not be health literate. We're make sure that when you're saying PHE, redetermination, unwinding, premiums, deductibles, all of these things and acronyms, that we're stepping back and are able to explain to patients what exactly that means and using terminology that's known to them. Next slide, please.
Thank you, everyone. So a lot of resources and links were mentioned today. So we have, and thank you, really, the team has compiled this slide with the links that they said that they have found the most useful. Notice that it's a combination of some federal, some national, and some local links as well. You know, there was a link to the CMS toolkit, and I would just want to make sure folks know that there are resources out there that you can take and make your own. So now we're going to transition into the Q&A part of today's webinar, and we have the remainder of our time to get hopefully in the weeds and answer some of your questions. Just a reminder, a friendly reminder that if you could please put the questions in the Q&A feature and not the chat, that would make our lives a little easier, but we'll do our best to get to your questions. And so the first one I really have actually was, I think, a question that was addressed in the very beginning, but I want to make sure it's very clear. And so I'm going to turn it over to Jeremy. There's a question to request to refresh their memory on the timeline associated with the PHE. winding down. So Jeremy, do you mind just recapping that for us?
Yeah, and Alyssa, can we go back to the slide deck? I want to say it's probably around slide 15. Is that possible? Okay, yeah, pause right there. So there was a conversation in the chat about the dynamics related, excuse me, the timeline related to the public health emergency. The feedback that I saw in the chat was absolutely accurate, but I just want to outline this one more time. So the current iteration of the public health emergency, we are in a PHE 90-day window right now. The next expiration date is set for, I believe it's July 15th. If I'm off by a day, apologies. But the PHE will expire. The next round will be approximately July 15th. The Biden administration has said in writing, in press interviews, in various ways, they will provide states with 60 days notice of its eventual expiration. And so we are obviously within that 60-day window for July 15th, which means for all intents and purposes, we have every expectation. Sure, I don't want to say guarantee, that's because it's not my guarantee to make, but we have every expectation it will be extended again until mid-October. I think October 13th is the exact date. Now, again, as I alluded to, there's obviously an election in November. There's a lot of conjecture that whether because of the nature of the pandemic or it being close to an election, that it seems unlikely that it would be allowed to expire that close to an election. That's just opinion sort of floating out there. That's not, that's not a factual statement. And so if it were to be extended again at that point, then it would go until mid-January. Now, Alyssa, can we go to the next slide as well? And so actually, Alyssa, go back real quick. I'm sorry to make you jump around. On this chart, you can see here the continuous coverage protection will ultimately be lifted on January. Let's assume, for all intents and purposes, that it would be that the PHE would expire in mid-January. Then January 31 of 2023 would be when the continuous coverage provision would ultimately be lifted. And now, next slide, Alyssa. This is where this 12 but actual 14-month window would kick in, where states can begin their disenrollment procedures up to 2 months before the expiration of the PHE. Nobody can actually be disenrolled in that period. And then obviously this plays out all the way to the 14 months. I will work to, and again, big shout out to the Georgetown Center for Children and Families. They created this, and we are working closely with them. But there was an earlier version of this that included the dates that line up with the PHE. Obviously because it keeps getting extended, those keep changing. But if we can get a new one for folks, we'll try to do that. But again, we have a little bit of lead time again, based on the PHE part. Ted, I'll pause there. I hope that was trying to be comprehensive without pontificating, but I hope that covered it.
No, thanks, Jeremy. That's great. We want people to leave feeling clear about the potential timelines, knowing that there's uncertainty about them. So I think this slide's really helpful. And again, want to refer people back to if there are continuing questions. And Jeremy, I know you have your contact information, so folks can reach out to you as well.
Yeah, Ted, I don't know if it'll come up in Q&A. I do want, before we close, there was somebody that asked about that Noddle pod that I was alluding to. I'll touch more on that before we close, but.
Okay. And just for my outreach and enrollment learning collaborative people, we have our own learning Noddle pod community, but NAC also operates, Noddle pod communities for different audiences. So Jeremy's referring to something slightly different. There was a question that came up around special and vulnerable populations. This is from Barbara DiPietro from National Healthcare for the Homeless Council. Hi, Barbara, great to see you here today. And it was, what are you doing to assist patients who are homeless, since they tend not to get mail-ins or other paperwork that Medicaid sends? And I'd also just like to sort of pause for a second and for our panelists extend that to other special and vulnerable populations, since we know the 330 statute defines other populations like migrant workers and people, residents of public housing. So again, what are you doing to assist patients who are homeless, since they tend not to get mail-ins or other paperwork that Medicaid might send?
This is Becky. I'll start. So our outreach and enrollment, like I have stated before, we have these community connection partners that we work with, and homeless shelters are one of our organizational pods that we work closely with. So we are making sure that the Local homeless shelters have our contact information and have those flyers about the unwinding and the process of how to get assistance and where they can go for that. But we do that with all of our community connections. We're making sure that all the places that we work with and people that work with Medicaid recipients receive that information.
We have staff who's actually placed in these transitional living facilities, resource centers, emergency shelters, places for people who are suffering from domestic violence. We're placed in there weekly to meet with residents and people staying there and getting resources to answer questions, to help with enrollments. We're meeting them at the places in which they receive their services.
At North Country, we have medical mobile units that go out in all of our regions and work really closely with the vulnerable population, especially the homeless. We're very consistent in the services that we provide. The letters and the home address requirement for our applications, they oftentimes use the shelter as a place of getting their mail. So a lot of the people experiencing homelessness will use that as a resource. They just write a statement saying that they're homeless and they could provide any other address where they like to receive mail.
Thank you all so much. There's another question I'd like to just ask around misinformation. There's obviously a lot of confusion, frankly, around the timing of this and I'd say uncertainty. We know there is some misinformation, sometimes even from being reported in the media, but then also just general confusion. And we know even if this is not on folks' radars right now, there will be misinformation as we get closer to the actual unwinding. So what are you all doing to really prepare and sort of address that misinformation?
I'll kick this off and just say that ever since we started enrolling people when the public health emergency began, we've had this conversation around we don't know when this will end, and we'll make for sure that we stay connected around this. So we've done a lot of proactive messaging. When you get enrolled, the agencies aren't necessarily able to say you're going to stay enrolled for the next 2 years. So we've had this relationship with our patients in the community, and we're available to answer questions when they call. But in general, they're not necessarily aware of all this background discussion about the public health emergency and unwinding and when it may end. We're here to field those questions, especially if they get conflicting messages or information saying their benefits will end. But in general, we've laid the groundwork when we get them enrolled about you will have this benefit for as long as the public health emergency ends, and make for sure you watch for mail because someday these policies may change.
I agree, Julia. So we do the proactive messaging as well with each client and consumer that we assist in presumptive eligibility, Medicaid, SNAP, marketplace applications. When we mail to them the address they provide to us, when we mail them information, we also include a next step sheet for things to be aware of. So right now it does say, there's a renewal process involved. It's typically every 12 months, but due to the PHE, this has been extended. And we're also a frontline question fielder for a lot of our consumers that when they call JFS or the Ohio Department of Medicaid and they're put on hold, they will actually call us because they don't want to sit on hold for 2 or 3 hours to get a response. So we are doing everything we can proactively to encourage anyone that has Medicaid right now to update their contact information and their phone number, their address, how it is they want to be notified of any upcoming changes.
I think just looking at it more broadly too, is that if we stay on the same consistent messaging locally, state and federal, I think if we are really confident in the information and being sure that we're staying consistent throughout all platforms, we're going to eliminate a lot of that or prevent a lot of that miscommunication or misinformation. So if we're making sure that all the staff are informed of the same thing, providing those trainings, being able to ask those questions, I think it will help a lot of the misinformation out there.
That's just so excellent. I love those comments. You all are very just kind of measured and prepared. I think that's what folks need, the focus on proactive, consistent messaging. Also, a shout out to the three of you, because your key messaging slides, I realize, are basically all sort of the same thing in different ways, really around updating contact information, checking mails for letters, you know, and then going to the marketplace if eligible. You know, I think that's so important right now in terms of distilling, you know, some of the actual information about what's happening. There was actually a question just around text messaging. It was, I guess, how is it being paid for? Where's the funding come from? So I don't want to put you on the spot if you don't know that, but if there's anything more you could say around, you know, is this sort of a health center that your health center has this, and then, you know, your department's able to access it? Or Abby and Julie, you mentioned it specifically, so interested in your insights.
I can go first. So the funding primarily will be coming from our marketing budget. So that will be our base grant funding that will be allocated through the marketing department, which will then pay for it. We are also using some Navigator funds, which are specifically allocated for the PHE unwinding. So we're able to use some of those funds towards this kind of information update in line for the PHE ending. So that's kind of some of the funding. And then of course, we can also, if we're needing extra funding, to maybe go to the health plans and ask for that funding in order to support the information update.
So partnership made the decision to use care messaging as a platform to message in a variety of ways to our patients, and outreach and enrollment can utilize that as well. But I'd say that we maximize funding from a variety of sources through our contracts with our federal Navigator entity, through the regional enrollment revitalization funds, from a variety of sources to push out all the messaging that we plan on using through social media or web-based platforms or billboards or radio ads. This is going to be a time to message not only to our Medicaid members, but as we transition into open enrollment, which is the next big thing on the forefront. And we hope that doesn't align with the PHE unwinding, Jeremy. But, you know, we're always looking for creative ways to use our dollars and our partnerships to spread the word.
Julia, just remember, I have zero control over the federal public health emergency designation.
And Julie, you actually answered or addressed one of the questions that came in just around how, you know, you're sort of aligning this with sort of preparing for, you know, the upcoming open enrollment period, which is hard to believe is OE10. Some of us have been doing this since the beginning, so time really flies. We're basically at the time, but there was one question I just wanted to raise quickly before we end, which was, you know, are there any of the panelists in states that's not a part of the federal exchange, healthcare.gov, and instead have their own state exchange? So, you know, the answer is no. Our panelists use healthcare.gov. But, you know, Jeremy, I'd kind of be interested in your thoughts, just, you know, on how you see these, you know, the importance of working obviously with your exchange and with your state unwinding task force, as some of our speakers highlighted, but kind of anything else you have to add there for folks in state-based marketplace states.
Yeah, I appreciate the question, and I have reached a point where I don't mind saying I don't know, or I don't have a ton more to add, but just a couple of immediate thoughts. Number one, you know, so I know in terms of state-based exchanges, it really kind of depends on the state. Sometimes it's, I think for the most part in most states, it's housed within, you know, so it's either a quasi-governmental organization or it's housed within your state health department. I used to work in the Maryland state legislature, so I'm more familiar with Maryland than other places. My main piece that I would emphasize if you're in a state-based marketplace state is to reach out to those officials and, you know, try to engage with them if you haven't already, to find out what they're doing to improve alignment as it relates to this issue. One item, and this directly ties into our role as a national organization, you know, is so many of the various players that are going to be influential in this process. Great example is managed care organizations. all of, and provider groups and all of those sorts of entities have a NAC. They have a similar national organization. And what we are trying to do is at our level, reach out to our counterparts and say, hey, what are you hearing from your members on the ground? But it helps so much to hear from you all, because there's some of you that we've heard from, look, our MCOs in our state haven't been super engaged on this. And so, again, I know this is the third time I'm saying it, but we take very seriously our role to try to apply pressure when we can, to try to collaborate when we can with other folks in the national space to support you all at the local level. Ted, is now the time to mention NoddlePod one more time, or do you want me to pause? You want me to wait?
I think that would be great.
Great. So I alluded to it earlier, and Ted is right. There are various NoddlePod sites out there, but something that we are going to be launching here, and I don't have an exact date for you yet, because there's some other piece mechanics that are kind of tied to this, but we do want to create a central community where so much of the information that we're seeing in the chat right now, you all can share. All of these speakers that you've heard from, these various webinars and resources, we want to create a one-stop shop where you all can access that. I would just say we will most likely send access to that site to all of you anyway, but if you are interested in being plugged in, please let me know, reach out to me or Ted or anybody else. There's no wrong way or wrong door for that. But that's it. It's coming. I know a couple of folks asked for it. It's not really it's not there yet, but it is coming. So that's it.
Thanks so much, Jeremy. So we're over time, and I want to conclude today's webinar first by just giving a big shout out to our wonderful presenters. They worked really, really hard on this. And so shout out to Julia, Abby, and Becky. Great content. And as Jeremy said, again, Jeremy, thanks for the wonderful kind of overview and framing of just the policy. This is still in the works. We're still kind of, I won't say the beginning stages, but there's still a lot more to come. So you're registered for this. You will receive the archive recording in addition to the slides. I saw a comment about getting kind of more nuance for state-based marketplace states. So I think that's a really great way, Jeremy, maybe to think about building out our NoddlePod community to kind of get some of that, for a more focused conversation there virtually. So with that, everyone have a great rest of your afternoon and keep up the